With that, we move on to the next lecture given by Professor Hong Lu, I hope I pronounced it right, from Chengdu, China, from the second affiliated hospital of West China University. And she will talk about the potential of contrast-enhanced ultrasound for the assessment of tubal patency. Dr. Lu?
Hi. Good everybody. My name is Lo Hong. I come from West China Second University Hospital, Sichuan University. Good everybody. Welcome to European Federation of Associates of Ultrasound in Medicine and Biology webinar channel sessions. I'm going to talk about the clinical application of HyCoSy. This is the outline of my talk. I will cover the background, the methods, and applications. First, the background. 10 to 50% of women of reproduction age are infertile, among whom 3 to 15% were caused by tubal infertility. Here are 4 commonly used methods of HyCoSy: X-ray Bilateral angiography, laparoscopy, hydrotubation, CEUS with hydrogen peroxide and crystal oxygen. All these conventional used methods have their only disadvantage. Therefore, a new method is desired and solely contrast-enhanced ultrasound emerges. Mechanisms of HyCoSy. Solar contrast agent produce remittent resonance motion in uterine fallopian tubals, generating linear and nonlinear echo, increasing microbubble reflection interface, and enhancing echo signal, which enable the development of fallopian tubals that cannot be shown by general ultrasound examination. Now, let us move on the methods. The first one is infertility. HyCoSy can be used for the diagnostic examination for tubal patency, congenital malformation, or pathologic conditions of the uterus and fallopian tubal. Second, HyCoSy can check the situation of uterine, mucosal, and uterine cavity. It can be used to evaluate the canalization after tubal ligation. There are 5 contraindications. Firstly, in the infection, including acute inflammation of the internal and external genital, and acute attack of colic inflammations. Secondly, endometrial injury. So we would not do HyCoSy within 6 weeks after normal delivery, abortion, suction, or CEUS. Thirdly, some conditions not suitable for HyCoSy, such as uterine malignant tumor, suspected cervical cancer, and serious heart and lung disease. The fourth contraindication is pregnancy. Lastly, HyCoSy is also not suitable for patients allergic to contrast agent. Now, imaging steps. Step 1, intramuscular atropine injection 30 minutes before intrauterine catheterization. The main purpose is to relieve spasm of smooth muscle and internal colic. Step 2. The patient is placed in the lithotomy positions, sterilized, cervix exposed, and then we insert the disposable intrauterine fluid contrast tubal into the uterus cavity and inject 1 to 3 ml normal saline into the air bag. Step 2. Do the conventional two-dimensional vaginal ultrasonography to scan the pelvic organs, observe the size and position of the balloon, the situation of the uterus and appendages, and the presence of liquid dark areas in the uterorectal lacuna. The fourth step is to do intrauterine contrast images. Normal saline angiography was injected through the catheter to observe whether there was occupation and adhesion in uterus cavity. This is normal saline was injected through the catheter to observe where there was occupation and adhesion in uterus cavity. The fifth step is to do 3-dimensional ultrasound prescanning of uterus and ovary. The purpose of the steps is to choose the appropriate probe direction and determine the midplane imaging. This is a video for prescanning. We can see the midplane of image we choose, which can both slow uterus and bilateral ovaries. The sixth step is to do the real-time 3-dimensional contrast enhanced ultrasound. Here we can see the trend of contrast agent in the fallopian tubal and pelvic dispersion. We can see the contrast trend, the fallopian tubal and pelvic dispersion. This is dispersion. The next step is to do 2-dimensional contrast enhanced ultrasound to observe the movement of the contrast agent in uterus cavity and the fallopian tubal, the diffusion of contrast. This is a 2-dimensional contrast enhanced ultrasound image of fallopian tubal. This is fallopian tubal. This video demonstrates the distortion. This is distortion of the distal part of the right fallopian tubal. This is distortion. These pictures shows the diffusion of the contrast agent around the ovary and the pelvic cavity. This is contrast agent around the ovary. The wrapping of the contrast agent around the ovary can be classified into 3 types. This is ring wrapping. This is half ring or little ring wrapping. This is non-wrapping. This video demonstrates the contrast medial dispersion in the pelvic cavity. We use professional software to analyze the result. Let us move to the assess standards. We assess the result into 3 categories: unobstructed, per pass, obstructed. As you can see from the chart, each category is described in the following respects: resistance, imagine, fallopian tubal, shaping of fallopian tubal, contrast medial dispersions around the ovaries, and pelvic dispersion. This picture demonstrates unobstructed fallopian tubal. We can see the pathway. The tube is natural. The diameter of tubal are even without local enlargement or layering. The picture demonstrates the hydrops in the distal part of the left fallopian tubal, and its pathway is distorted. This picture demonstrates non-contrast imaging of the bilateral tubals, and no dispersion strongly suggests obstruction of bilateral fallopian tubals. Here are some cases I want to share with you about the clinical of HyCoSy. Firstly, let us look at the application in imaging of intrauterine lesions. We can see the precise contour of the uterine lesions after injection. Let us this case. Before hysteroscopy, we found the endometrial thickened without an obviously local mass. After hysterography, we can see several masses located in the posterior wall of the uterus cavity. This clearly illustrates the advantage of hysterography. The second application is to assess obstetric patency. This case is a 29-year-old female infertility for 3 years. We can see the ring wrapped contrast of bilateral ovaries. So we get the result of bilateral oviduct unobstructed. This is another case. A 45-year-old female infertility for 1 year. We can see the twisted pathway of bilateral oviduct with a little wrapped of bilateral ovaries and little contrast middle piece mixture into the pelvic cavity. So we get the result of the bilateral oviduct per pass. The next case is a 28-year-old female infertility for 2 years. We can see long wraps of right ovary and ring wrapped of left ovary. We get the result of obstruction and hydrops of the right oviduct, left oviduct unobstructed. This case is a 27-year-old female, infertile for 1 year. The conventional two-dimension ultrasound demonstrate that perioviary cystic mass, suspected hydrops. No contrast agent were observed into the oviduct infusion after injection. So the result is bilateral proximal tubal obstruction with right hydrops. The third application is the diagnosis of pelvic adhesion. This picture demonstrates non-contrast enhanced areas in the pelvic cavity. This suggests that there may be pelvic adhesion in these areas. This demonstrates contrast medium cannot disperse into the adhesions. This is adhesion areas. Now, today I share with you the clinical application of HyCoSy in uterus cavity lesions, tubal smoothness assessment, pelvic adhesion. Thank you for your attention. Thank you.
Yeah, thank you very much for sharing your experience with that interesting technique. And it is great to see that the indications for contrast-enhanced ultrasound are growing by the day. I received one question already from the audience on the management of contrast agent reflux. How do you reduce the contrast agent reflux?
Yeah, thank you. First, slow injection of contrast agent at low pressure. Rapid injection of contrast agent will rapidly increase the pressure of the uterus cavity, making it easier for the contrast agent to be pushed into the blood vessels and lymphatic vessels around the uterus under high pressure. Second, choose the right time, 5 to 7 days after your pelvis is clean. At the early stage of hyperplasia, endometrium is thin, and part of endometrium capillary have not been completely repaired. Due to the pressure of injection during angiography, contrast agent is easy to enter blood circulations through these incomplete tiny vessels, resulting in venous reflux. The risk of iatrogenic endometriosis is increased when the endometriosis is permanent more than 7 days after menstruation. Thank you.
Thank you very much. And for giving us all these practical tips. There's one more question from the audience on the contrast. How much contrast material do you use, and do you dilute this?
Depends on the situation.
And do you dilute this, or do you use the pure contrast?
Diluted.
Thank you so much. Okay, I don't see more questions, so I really thank you. This was really exciting. I was really looking forward to your presentation because I've never seen that, as I'm a thoracic radiologist, and this was really exciting to see. Thank you so much.